The Advisory Commission on Childhood Vaccines meets this coming Monday, just days after a Columbia University report presented new evidence of a possible link between autism and a preservative used in some vaccines. Cheryl Atkinson has the latest on a medical debate and anguished parents in tonight's Weekend Journal.
It's the first autism conference since the Institute of Medicine concluded mercury in vaccines probably isn't behind America's autism epidemic.
How many children have to suffer before you admit the terrible mistake that has been done?
Skeptical parents are confronting a CDC official.
And just like Arthur Anderson told the investors of Enron, "Oh, we've looked at this. There's no problem. Trust us." The CDC is going to become the Enron of the vaccine industry.
Joining them in challenging the findings, doctors, scientists, and members of Congress.
The IOM report of May 2004 is shamefully one-sided.
The day I read that IOM report, I was embarrassed to be a physician.
They claim a growing body of science links mercury in vaccines to autism. Like Boyd Haley's research, it shows some children can't get rid of mercury, a potent neurotoxin, and may be at risk for autism when they get vaccines containing a mercury preservative.
Why would public health doctors want to cover up something that could be so important?
Public health doctors wouldn't, but certain bureaucrats in the CDC would. People who made the mistake. It's a big embarrassment.
The supposed mistake was the CDC adding shot after shot to the vaccine schedule in the 1990s without bothering to consider all the extra mercury kids were getting. In a single doctor's visit, babies could get 60 times the EPA's mercury limit. In 1999, health officials asked vaccine makers to consider taking out the mercury preservative, yet told the public it posed no danger. Parents were never told about this draft of a federal study in 2000. Mercury in vaccines was associated with not only autism, but also ADD, language and speech delays, and more. But when the study was published last fall, those links had vanished, and the lead author had gone to work for a vaccine maker, a potential conflict of interest that wasn't disclosed. Dr. Marie McCormick's committee reviewed science on both sides but dismissed research supporting a link. She argues there's no cover-up, that the federal study's final data differed dramatically from the earlier draft that seemed to link mercury and autism.
What I'm saying is the laboratory evidence points to the fact that mercury isn't good for you, but I don't think it really provides evidence for the chain of events that would have to occur in order for it to be implicated in autism.
Despite that, the independent federal special counsel is adding to the voices who don't consider the case closed. He sent a letter asking Congress to address what he calls a very serious public health danger. Cheryl Atkinson, CBS News, Capitol Hill.